Hey everyone, it's DrRic. I am going to talk about double crush today. Double crush is a concept where you have a very delicate nerve being irritated at two areas with low pressure instead of one area at high pressure. And I'll explain that in a second. And I thought I would use my fishbowl setup to describe. So this is the pump, this is the air hose. That's where the air hose ends. Beginning, ending. And source through the tube is oxygen. Just pretend that I have an area here that I put down a lot of pressure. I put a lot of pressure on here, you won't see any more air get through. The product doesn't get through and the pump backs up. So I let up and the air gets through again. That's single crush. Usually think of it as a pinched nerve, or a carpal tunnel that's chipped off or breaking down or contracting over. When you have enough pressure at those areas, a disc or a wrist, the nerve won't progress its electric impulse down to the end, and you'll have numbness and tingling. Well, it can also, usually that's pretty painful. You'll have pain in the wrist, you'll have pain in the neck, and then you'll have the numbness and tingling because the nerve doesn't work. Well, in double crush, you can have two areas, not as intense, but two areas that will push down and also stop the air from flowing. It won't be as significant as a single big disc or a pinched off carpal, but it will slow down the function of the nerve. So when I let go of the two smaller areas, the air comes back full force. Now just think of this as double crush. My example, I'll turn around. The example would be if I have a nerve coming out up here and it travels from the disc area through the trapezius, down the shoulder, through the muscles of the forearm and into the tips of the fingers, anywhere along the line, if I have a disc back here, it'll pinch off the nerve. Nerve won't function. If I have a trapezius that's tight, like in thoracic outlet syndrome, it won't function. It'll chop down on the nerve. If I have a problem where the nerve goes across the small muscles of the forearm, you can have irritation and it'll cause a cubital tunnel syndrome. If you have it down here at the wrist, it'll cause a carpal tunnel syndrome. So there's a bunch of, there's even a problem where cyclists, because they're riding like this, will choke off the tiny nerve down here. That's not really double crush, but if you have that, because you're riding and you have neck pain from this, you can cause ultimately a twofold a problem with the nerve functioning. So that's essentially it in a nutshell. The idea is if you're suffering from pain and you're not sure, it could certainly be an irritation at one spot, but also if you don't have any problems with the carpal tunnel and the typical findings on physical exam, that's called a Phelan's test or a Tunnell's test. Tunnell's test is when you do like this and then you can reproduce the symptoms of numbness and tingling in the median nerve right here. Or Phelan's test is when you hold your arms like this for approximately 60 seconds and you choke off the nerve. Usually that's positive. Good likelihood it's going to be carpal tunnel. It's hard to really reproduce anything up here unless you get into the right position, whether it's thoracic outlet, a disc, or a problem with a cubital tunnel down here. But it's a matter of sometimes using, if this was a nerve, using an electromyogram or EMG to put a needle here, and send electric current through. We see how fast the current gets through, and we can tell, is that nerve in this area functioning properly? Then you go down the line, is it functioning here properly? And you look for the blockage. Hopefully a good neurologist or a physical medicine or rehabilitation doctor can do the proper EMG, NCV, and find where exactly to concentrate. Now, when you find where the blockage is, the highest suspected area, then you might progress on to an MRI of the neck or an MRI of the forearm, X-ray or CT scan of the carpal tunnels. It kind of depends on the reason. Usually, if you have two areas of choking, one surgically can be fixed, but the other, if it's a double crush, usually has to be manipulated with physical therapy, learning about scapular movement and stability, worrying about position of the neck. So I think either way, whether you need surgery in one spot or two spots or no surgery at all, you really should get into a physical therapist to teach you some of the dynamics, go over as a coach, make sure you're doing things properly. If you're in a sport, you want to make sure that your throwing technique that you've learned, even if you're you're an excellent thrower, you want to make sure that it is okay for the symptoms or the pathology that you've been diagnosed with. So if you keep on letting it go, it can be disturbing to the point of the nerve permanently not working in the form of either numbness and tingling or decreased reflexes or just a sensation of pain. Worst case scenario is you start to kill the nerve and you will have weakness and atrophy, and you don't want that. But usually it's so intolerable by that time, you'll beg somebody to cut into you or at least try to fix it with any means possible. So that dovetails me to the treatment plan. It kind of depends on where it is, but physical therapy is always going to be involved. Anti-inflammatories internally, herbally, should be involved. Anti-inflammatory diet, turmeric, sometimes magnesium to loosen up muscle. Sometimes they'll even use skull cap to relax, because usually when you have pain, your reaction is to tighten up. Skull cap, valerian root, 5-HTP, spray on magnesium, all relax, and they sometimes loosen up. If that doesn't work or it's very severe, then we go for prescription medicines, prescription anti-inflammatories, muscle relaxers at night, maybe even a steroid burst for a couple days. If you go higher up with the treatment plan, you will have higher side effects. Reiki therapy, pretty decent. Chiropractic, also very good, but it depends on the provider, so you always have to know or get a reference. Either way, don't let it go. You don't have to suffer. Sometimes splinting is good temporarily, or slinging is good temporarily, but you really have to intervene, because once you sling or splint something, it'll give you a temporary response, but then it'll weaken that joint that you sling because you're not moving it. So if you're going to put a sling on or a splint on, you really should be having a therapist design or an exercise physiologist design an exercise routine for you when you get out of the splint and out of the sling. It's always important to also work with topical oils. I think EMGs are painful, but TENS units and acupuncture are definitely worthwhile if you're not going the surgical route. So hopefully this gives you a little bit of an idea what double crush is. It can be debilitating. It can also be a big win if you can avoid the surgery if you don't need it.